Good morning. Today's topic is bonding agent. Content, introduction, history, definition, bonding mechanism, compatibility and contact angle, ideal requirement of bonding agent, microstructure of dentine, difficulties in bonding, smear layer, etching of enamel and dentine, hybridization, reverse hybrid layer, post hybrid layer, elastic bonding concept, wet versus dry bonding, chemistry of bonding agent, component of dentine bonding agent, classification of dentine bonding agent, water tree, amalgam bonding, ceramic bonding, cementum bonding, recent advances, conclusion. Introduction. Today, we are in age of adhesive dentistry, the traditional mechanical method of retaining restorative materials have been replaced by tooth-conserving adhesive methods. Development of adhesive approach to restorative dentistry has brought many advances such as better aesthetics, conservation of tooth structure, reduction micro leakage. Adhesive techniques has expanded the range of possibility for aesthetic dentistry. This is important as today's patients pay more attention to cosmetics than ever before. History 1951, Oscar Hager, a Swiss chemist, developed an acidic GPA DMA that permit resin as addition to dentine. The foundation for adhesives was made in 1955, where Buonacor proposed that the acid could be used to alter the surface of enamel to make it more receptive to adhesion. This hypothesis was based on industrial use of 85% phosphoric acid for 30 seconds. In 1957, Bowen worked on bisphenol A glycidyl methacrylate resin and subsequently formed the first composite material. 1960s, 1970s, first and second generation bonding agent. 1963, Stewart first described smear layer. 1970s, Eric et al. Described the composition of smear layer and its role in bonding. 1975, Brunet and Silverstone described three patterns of etching in enamel. 1973, total etch concept was proposed by Fusayama. 1980s, third generation bonding agent. 1982, Nakabayashi proposed the concept of hybrid layer. Early 90s, fourth generation dentine bonding system. 1992, Kanka et al. Has put forward the wet bonding technique. 1999, Prati and Pashley described the formation of reverse hybrid layer. Mid-1990s, fifth generation dentine bonding system. Early 2000, sixth generation dentine bonding system. 2003, seventh generation dentine bonding system. Definition, adhesion, the force or energies between atom or molecules at interface that holds two faces together. Adherent, the surface or substrate that is adhered. Adhesives, a material that can join substance together, resist separation, and transfer loads across the bond. Betting, the ability of the liquid to come in contact, imitate contact with solid substance, facilitating the bonding. Etching, the solution of the substrate removed by rinsing to enhance intimate contact of adhesives with collagen. Priming, the process of cleaning, structural alteration, and increasing the adhesiveness of the substrate. Bonding mechanism, mechanical adhesion, that can be by two methods, microscopic penetration and due to stresses. Diffusion, chemical adhesion. Chemically adhesion can be done by two methods, primary and secondary. Primary valence forces, which are ionic, covalent bond, metallic bonds. Secondary valence forces, van der Waals forces, hydrogen bonding. Wettability and contact angle. An important requirement for the occurrence of any of these interfacial phenomena is that two materials being joined must be sufficiently wetted with close and immediate relation. Beside an immediate contact, sufficient wetting of the adhesives will occur only if the surface tension is less than the surface energy of the adherent. Wetting of a surface by liquid is characterized by the contact angle of a droplet based on the surface. Angle between the adhesive and adherent, the contact angle 180 degree in non-wetting, contact angle greater than 90 degree in wetting, and 0 degree angle, when it's 0 degree angle is contact angle is 0 degree, perfect wetting. Smaller the angle, better the wettability. 180, not acceptable since all the liquid wet all the solids to some extent. 0 to 180 degree, poor or incomplete wetting. 0, spontaneous wetting of the liquid take place. Ideal requirement of dentine bonding agents. 1961, Phillips and Righi. High bond strength to dentine, provide bond strength to dentine similar to that of enamel. Biocompatibility to dental tissue, including the pulp. Minimize micro leakage at the margin of the restoration. Prevent recurrent caries and marginal staining. Easy to use and minimal technique sensitive. Good shelf life. Be compatible with a wide range of resins. Non-toxic, non-sensitizing to the operator or patient. Bonding agents to seal the tooth surface from the oral fluid. Clinical use of dentine bonding system. Bonding of directly placed resin-based restorative material. Bonding of indirectly placed restorative material. Bonding of ceramic restoration. Bonding of enamel restoration. Bonding of prefabricated and cast post. Bonding of orthodontic brackets. Bonding periodontal sprints. Repair existing restoration. Sealing of pits and fissure of posterior teeth. Treatment of cervical sensitive dentine. Reattachment of the fractured tooth fragments. Pulp capping. Reinforce fragile tooth internally. Seal apical restoration placed during endodontic surgery. Microstructure of dentine. It contains 20% fluid, 50% of hydroxyapatite crystals, and 30% collagen. They are arranged in a peritubercular dentine, intertubular dentine. Human dentine is a heterogeneous material composed of solid, circumpapillar space surrounding a network of tubules. These tubules, measuring about 1 to 3 micrometers in diameter, contain elongated cell bodies that radiate from the dental pulp organ throughout the entire dentine. Dentinal tubules, pulp and DEJ, diameter 2.5 microns, 0.8, number 45,000 in pulp and DEJ 20,000. Tubular surface area 25% and 3%. Dentine is composed of different volume fraction of inorganic calcium hydroxyapatite, proteins, mostly collagen and water. These three phases creates the basic building block of bone and teeth. Collagen, a triple helical protein, self-organizes into bundles called fibrils. These fibrils are well organized and contain regularly shaped spaced region of high and low protein density called the overlap and gap zone respectively. The hydroxyapatite crystals are believed to then grow within these gap zones, reinforcing the weak collagen structures. These tubulars span the thickness of dentine from the pulpal cavity to the surface of dentine and are surrounded by highly mineralized rings of hydroxyapatite called peritubular dentine. The mineralized collagen fibrils are then organized tangentially to the surface of the PET, that is peritubular dentine, creating intertubular dentine. The complex structure allows the dentine to be tough and strong, thus maintaining the structural integrity of the teeth. Difficulties in dentine bonding. Complex histological structure and variable composition. Contain vital processes of the pulp odontoblast, hence vital dentine is a sensitive structure. Higher water content provides competition with any adhesive biomaterial for bonding to dentine. Dentine is subjected to physiological and pathological changes in composition and microstructure due to aging and irritations. Plasma-like fluid in dentinal tubule is under a slight but constant outward pressure from the pulp, which is 25 to 30 mm of Hg. Regional variation in permeability is a characteristic of the dentine. Smear layer. While instrumented in addition to superficial debris, it has been shown using the scanning electron microscope that a layer of sludge material was always formed over the surface of dentinal walls. This layer of debris has been called the smear layer. The inorganic material in the smear layer is made up of tooth structure and non-specific inorganic contaminants. The organic component may consist of heated coagulated protein, gelatin formed by deterioration of collagen heated by the cutting instruments, necrotic or viable pulp tissues. Factors affecting the formation of smear layer. Speed. High speed instrumentation. The smear layer is tightly attached to the prepared surface. Types of instrument. Coarse diamond bars produce a thick smear layer than a carbide Fisher bars. Coolant or water spray does not prevent smearing but appears to significantly reduce the amount and distribution of it. Now, the question arises whether we should remove or retain the smear layer. Remove. The exposed collagen network provides reactive groups that can chemically interact with primers. Exposed collagen promotes micromechanical bonding to resins. Tubules are open for good retention. Retain. Use a bonding agent that can penetrate the smear layer and incorporate into bonding layer. Protective barrier. Lowers the dentinal permeability. Lowers the pulpal pressure. Etching. The objectives of enamel etching are clean the enamel, remove the smear layer, creates micropores that is 20 to 25 mu by removal of prismatic and interprismatic mineral crystals, increase surface energy of enamel 2000 times to produce monomer infiltration to seal enamel surface with resins. All these contribute to retention of the resin composite restoration. Two types of resin tags interlock with the etch within the etch pits, macro tags and micro tags. Macro tags, space surrounding the enamel prism. Micro tags, resulting from the prism infiltration, polymerization within the tiny etch pits at the core of the etched enamel prism. Later are specially thought to contribute to regards to retention to enamel. Figure A shows the enamel rods are more effectively etched, producing a deeper micro undercuts than when only the sides of enamel rods are etched. %50 phosphoric acid for 60 seconds, monocalcium phosphate monohydrate precipitate, concentration below 25%, dicalcium phosphate dihydrate precipitate, concentration above 40%, dissolves less calcium and etch pattern with poor definition. 37% for 15 seconds is considered appropriate. Citric acid 10%, polyacrylic acid 40%, and malic acid. Etching pattern. Enamel etching results in three different micromorphologic patterns as described by Silverstone et al. In 1975. Type 1, which is a honeycomb, involves the dissolution of the prism core without dissolution of prism peripheries. Type 2, etching pattern, the peripheral enamel is dissolved but the core are left intact. That is cobblestone. Type 3, etching pattern is a mixture of type 1 and type 2 configuration. Type 4, patterns has etched as pitched enamel surface. It is displayed only a random distribution of depression with no preferential destruction of either cores or peripheries. These pitted areas occasionally occur in little patches over the enamel surface. Type 5 has a flat, smooth surface after etching. Similar to the type 4, type 5 etching shows no evidence of prism outlines. Type 5s are extremely flat and smooth and they lack micro irregularities for penetration and retention of resins. Percentage of frequency of observation. Types of etch pattern. Type 1, coronally 75%, middle location 20%, cervical 5%. Type 2, coronal 75, middle location 20, cervical 5. Type 3, in coronal 10%, middle location 80%, cervical 10%. Type 4, coronal 5%, middle location 20%, cervical 75%. Type 5, coronal is 5%, middle location is 20%, and cervical is 75%. Etching time, it's 15 to 30 seconds for an adult. For infants, it's 40 to 60%, for 60 seconds. In fluoresces or fluoresces, in case of fluoresces, it's 60 to 90% seconds. Changes in dentin structure after etching. Changes in intertubular dentin exposes longitudinally obliquely oriented collagen fibers, interfibril spaces 15 to 20 nanometers. Changes in peritubular dentine, open tubules orifice in typical funnel-shaped configuration exposes circularly oriented collagen fibril arrangement, decreases surface energy, increases surface roughness. Hybridization, Nakabayashi, 1982. The structure formed in dental hard tissue by demineralization, the surface and substrate, followed by infiltration of monomers and subsequent polymerization. Zones of hybrid layer. Top layer, amorphous electron-dense phase consisting of denatured collagen. Middle layer, cross-section and longitudinally sectioned collagen fibrils separated by electrolucent spaces of 10 to 20 nanometers. Bottom layers, gradual transition of underlying unaltered dentine with partially demineralized zone containing hydroxyapatite crystals enveloped by resins and abrupt transition. Tubule wall hybridization, extension of the hybrid layer into tubule wall area, hermetical sealing, the pulpal dentine complex against microleakage, especially protective when bond fails at the bottom or top, at top or bottom of the hybrid layers. The resin tag keeps the tubule sealed as they break off at the level of the hybrid layer. This is attributed to tubule wall hybridization, which ensures a leakage-free seal of tubules. Lateral tubule hybridization, formation of tiny hybrid layers into the wall of the lateral tubule branches. This microconversion of the hybrid layer typically surrounds a central core of resin called the microresin tags. Nanoleakage. The susceptibility of this demineralized collagenous zone was proved by Sano et al., who showed the penetration of silver ions beneath the resin's impregnated layer between the resin and decalcified to structure, even in absence of any gap formation. Presence of submicrospaces within the hybrid layer in the absence of gap formation between the composite resin composite, and hybrid layer. They also stated that this might allow dentinal or oral fluid to slowly penetrate through the hybrid layer into the non-hybridized collagen zone, causing it hydrolytic degradation even in the absence of microleakage. Reverse hybrid layer. Prati et al. Reported the formation of reverse hybrid layer by application of sodium hypochlorite after acid etching. This procedure not only removes the exposed collagen but also solubilizes the fibrils down into the underlying mineralized matrix to create submicron porosity within the mineral phase. Cylindrical channel previously occupied by the collagen fibrils are now available for resin infiltration within the mineralized matrix. Such dentine surface has been proposed as mineralized hydrophilic alternatives to a collagen-rich hydrophobic acid remineralized dentine possessing increased stiffness. Ghost hybrid layer, aluminum oxide air abrasion, results, which is depicted in the figure by white arrows, results in a partial removal of the original hybrid layer followed by the formation of new ghost-like hybrid layer. This adhesive layer interface it was also modified, allowing for the incorporation of aluminum oxide powder even after cleaning. Elastic bond concept. The final stiffness or rigidity of the resin composite may play a compensating role in coping with the polymerization stresses. Viscous adhesive, thick resin layer stretching of this layer provides a sufficient elasticity to relieve stress of the resin composite. Bonding layer thickness is 125 μm. Versus dry bonding. Wet bonding was introduced by Kanka and Vnit et al. In 1990s. When acetone or alcohol-based primers are applied to a moist, demineralized dentine, water diffuses from the wet dentine into acetone, while the acetone diffuses into the demineralized dentine matrix. This chemical degradation, dehydration of the collagen network caused by substitution of water by the acetone, also increases the modulus of elasticity of collagen. Water is gradually lost as a solvent and resin monomers occupy the space around the collagen fibrils. Therefore, there is much less shrinkage. Disadvantage: acetone quickly evaporates and should be quickly applied. Ratio of monomer and acetone changes. Another disadvantage of keeping the cavity walls wet after conditioning is that one cannot observe white frosted appearance of enamel that indicates that it has been properly etched. Dry bonding. Dry bonding refers to the bonding in which the acid etched dentine is dry and uses the adhesive system that provides water-based primers. Too much water would rapidly re-expand the collagen network but would not dilute the monomer concentration. 35 to 50% HEMA in water provided the maximum bond strength. Water in these primers probably plasticize the stiff collagen network so that it can re-expand and increase its permeability to the primer resins. Over dryness, there will be collapse of collagen fibers and demineralized dentine. Ineffective penetration due to the collapsed collagen has been observed ultramorphologically as a formation of the hybrid zone. Overwet phenomena. In total edge, wet bonding technique, there's a danger that some region in complex cavity preparation, such as proximal boxes, may be too wet. When single bottle primer adhesives are applied, the solvent may diffuse into the water instead of vice versa, forcing the adhesive monomer to undergo phase change, forming a blister resin globules. Now, the chemistry, where the first M circle depicts M, second R, and third X. M is the double bond of the methacrylate, which copolymerizes with the composite resin. R is a spacer which makes the molecule larger. X is the functional group for the bonding, which bonds to the inorganic or organic portion of dentine. Bonding to the organic part of dentine, interaction with amino, hydroxyl, carboxylate amide groups present in dentinal collagen. Dentine bonding agents have isocyanates, aldehydes, carboxylic acid, anhydrides, carboxylic acid chlorides, which extract hydrogen from the above mentioned groups and bonds chemically. Components of the dentin bonding agents: etchants, primer, adhesives, initiators and accelerators, fillers are the ingredients. Etchants, alteration of dentin surface including smear layer with the objective of producing a substrate capable of micromechanical and possibly chemical bonding to the dental adhesives. Various acid etchants are used are organic, polymeric, mineral acid. Organic acids are malic acid, tartic acid, citric acid, EDTA, acidic monomers, mineral acid, hydrofluoric acid, nitric acid, hydrofluoric acid, polymeric, polyacrylic acid. Calcium chelators removes the smear layers without decalcification or significant physical change in underlying dentine substrate. No funnel shape changes are seen. EDTA pH is 7.4. Tablicet acid is 0.1% EDTA, 0.15% benzoyl chloride, scrubbed on the surface for a few seconds, smear layer removal and smear plug intact. Laser, yeah, anti-white lasers are used at at 10 to 30 pulses per second. The surface is desensitized by occlusion of open and permeable dentinal tubules. Air abrasion Aluminum oxide particles are used for air abrasion of particle size of zero point 0.5 microns. Primers are defined as chemical capable of improving the wettability of the adherent or capable of being incorporated into the surface of the substrate to form chemical bonds across interface. Addition, promoting agents, hydrophilic, rule of the solvent ethanol, acetone, objectives, hydrophilic, hydrophobic, and spongy. HEMA, the main component. More commonly used primers are 2 to 5% NTG or GMA, 16% BDP, BPDM, 30 to 55% HEMA, 6% Penta, 10% PMDM. Adhesives from resin tag to open the dentinal tubules initiates and advances the polymerization reaction and copolymerizes with the primer molecule. Stabilizes the form hybrid layer and resin tag, provides sufficient methacrylate double bond for copolymerization with successively applied restorative resins. Commonly used are bis-DMA, UDMA, TEC-DMA, methacrylate phosphates, and penta. Act as stress relaxation buffers to relieve polymerization contraction stresses. May contain pillars, optibond, solo prime, and bond anti. Initiators and accelerators, light cured, camphoquinone, and an organic amine, dual cured, bonding agent, catalyst to promote self-curing, fillers, mostly unfilled inorganic fillers, 0.5 to 40% by weight, microfillers or nanofillers. Function of nanofillers, prevents nano leakage, cause uniform thickness of adhesive layer, better flexibility of to adhesive, better deception of forces, scatter of light is prevented. Now, classification. First generation dentine adhesives. These contain N-phenylglycerin and glycidyl methacrylate. NPG-GMA is a bifunctional molecule. This means that one end of this molecule bond to the dentine while the other bond polymerize to composite resin. Bond strength is 1 to 3 megapascal. First commercially available Servident chelation with calcium on the tooth surface to generate water resistance chemical bond of resin to dentinal tubules. Agents used in this generation NPGMA, glycerophosphoric acid dimethacrylate, cyanoacrylates, polyurethanes. Disadvantages: low bond strength of only 2 to 3 megapascal, hydrolysis of GPA DMA in oral environment, difficulty in bulk polymerization of cyanoacrylates, instability of the NPG GMA in solution. Second generation adhesives. Phosphate ester dentine bonding agent was introduced containing phenyl P and HEMA and ethanol. Its mechanism of action was based on polar interaction between negatively charged phosphate group in resin and positively charged calcium ions in smear layer. Bond strength is 1 to 5 megapascal. Examples: Clearfield bond strength, Bond Light, Kerr, Prisma Universal bond strength, Johnson's and Johnson's. Disadvantage: low bond strength of 1 to 10 megapascal, hydrolysis of the bond between the phosphonate ester and dentine, poor clinical performance. Bond achieved by limited cohesive force in smear layer or break the smear layer dentine surface. Resins devoid of hydrophilic group and large contact angle on intrinsically moist surface and did not wet the dentine one. Third generation, three-step system, phosphate-based HEMA plus 10 MDP required either removal or modification or dissolution of smear layer. Denting etching was introduced by Fusima primer application of the unfilled resin. Bond strength was 3 to 8 megapascal, example Scotch bond. Fourth generation, Early 90s, total edge concept, moist bonding, hybrid layer, Nakabayashi in 1982, impregnation of the resin into partially decalcified dentine, followed by polymerization, created a resin reinforced. Advantages: good bond strength of 17 to 25 megapascal. No reduction in bond strength will apply to moist surface. Can bond to mineralized tissue as well as metal, amalgam, composite, and porcelain. Disadvantages: multiple steps, technique sensitive. Unless the primer and adhesives are applied consequently, the overlying composite resin will not bond to the surface. Agent used in this generation: all bond, amalgam bond, clear fill liner bond, Purva bond, OptiBond, Scotch bond, multipurpose. Fifth generation totally removes layer based on total etch concept. Two system etching plus bond priming plus bonding. Moist bonding technique. Advantages: good bond strength, time saving, and relatively simpler to use. Some agents have incorporated fluoride and elastomeric component to improve the marginal integrity. Disadvantage: they may lack many of the components to perform multi-substrate bonding. Post-operative sensitivity, most common in situations that magnifies the effects of the composite polymerization shrinkage. Sixth generation, early 2000s, primer and etchant are combined in one step. Self-etching primers contain phosphate derivatives of hydrophilic monomers such as phenyl P. It also contains 50% HEMA or other hydrophilic monomers so that both etch and prime the dentine. Type 1, two-step non-rinsing conditioner self-etch primer system. Type 2, one-step self-etching adhesives all in one systems. Examples: Clearfill SF bond, simplicity. Advantages: no need to acid etch with phosphoric acid, no post conditioning, rinsing required, reduced post operative sensitivity, simultaneous demineralization and resin infiltration, less sensitive to degree of wetness and dryness, low technique sensitivity. Disadvantage: less effective bonding of enamel. Initial bond might deteriorate with aging, which could lead to premature failures. Bonding to sclerotic and caries affect the dentine may be problematic, may inhibit set of self-cure or dual cure resin material. Seventh generation. This system is quite similar to sixth generation, but a desensitizing agent was added to overcome the problem of hypersensitivity. It is a single component, no mix, one step application, dental adhesives with an etchant, adhesives, desensitizer, and photoinitiators. They combine conditioning and priming and application of adhesive resins, but unlike sixth generation, do not require mixing. Contain both hydrophilic and hydrophobic components. Disadvantages: complex nature of mixed solution, more prone to phase separation and formation of droplets with adhesive layers. Lack of polymerization, thin film, example, I-bond, xenophore, G-bond, complete, optimond, all in one. Abduct prompt it has three components: compartment 1, compartment 2, and compartment 3. Compartment 1 containing methacrylate phosphoric acid, ester photoinitiators, and stabilizers. Compartment 2 contains water, complex fluoride, and stabilizer. Compartment 3 has a microbrush. Now, we'll see the classic category of fourth generation examples: OptiBond, which has the bond strength of 70 to 25 megapascal. Fifth generation Prime and Bond, 20 to 25 megapascal. Sixth generation Clearfill SE, 18 to 25 megapascal. Seventh generation Prompt LOP, 20 to 30 megapascal. Comparison of the performance of current self-etch adhesives with etch and res approach. Hybridization of dentine. Etch and rinse, difficult to perform but stable and durable over a time when done properly. Self-etch, easy to perform, durable, primary for mild and self-etch adhesives. Bond to enamel and marginal integrity on enamel. Edge and rinse excellent. Self edge fairly good and clinically acceptable and can be improved by additional phosphoric acid etching. Post operative sensitivity, good chance for this, especially with over etch or over dyeing of dentine. Less chance of this, but not impossible. Water solubility of the surface adhesives withstands hydrolysis fairly well when nano leakage is absent. Self etch higher, some call them a semi permeable membrane. Color stability of the adhesives, good color stability, good choice for high end aesthetic restoration. Not that good owing to its hydrophilicity, good chance of water uptake, stains accompany the water in the adhesives. Ease of use, if operators well trained and potential errors are recognized, not difficult to use. Easier to use but technique sensitive too. Most difficult is the removal of the water from the adhesives. Classification based on the number of clinical application steps. Etch and rinse. 3-step, 2-step. 3-step, conditioner, primer, adhesive. 2-step, conditioner and one bottle, primer plus adhesive. Self etch, 2-step, conditioner and primer and adhesive. 1-step, conditioner, primer and adhesive in a single bottle. Classification of bonding agent based on the effect of smear layer. Smear layer removing the dentine bonding agents used after the smear layer is completely removed using a total etch technique. Enamel and dentine are simultaneously etched using 37% phosphoric acid. Bond to dentine micromechanically by formation of resin tags and hybrid layers. Example, single bond, Gluma, OptiBond Solo. Smear layer modifying dentine bonding agent. Aim to modify the smear layer and incorporate it in bonding process. Based on the concept that the smear layer is a natural barrier to the pulp, preventing bacterial penetration, reduce outflow of dentinal tube fluid that can affect bonding, removal of only superficial smear layer and can resin intermingling with deeper layers. Example, Pro Bond, Prime and Bond, Compo Glass. Smear layer dissolving dentine bonding agent. Demineralize the smear layer and superficial dentine without removing smear layer plugs. Self-etching primers and self-etching adhesives. Both enamel and dentine are simultaneously etched and primed by acid primers. Example, self-etching primers, adhese, self-etching adhesive, prompt pop. Classification based on fillers, low filled, high filled, low filled, lower film thickness, applicable in situation in which adhesives must be light cured before seating in direct restoration, high fill, greater film thickness, stronger physical properties. Classification on based on fluoride release, high fluoride releasing adhesives, fluoride free adhesives. Slow release of fluoride increases the local concentration of fluoroapatite and mineralized dentine just beneath the hybrid layer. Less soluble mineral penetrate prevents release of hydrolytic enzymes from the mineralized matrix, thus improving along the long-term stability. Classification of the bonding agent based on the shear bond strength. 3 categories of dentinal adhesives are proposed. Category 1 includes adhesive with smear bond strength values between 5 to 7 megapascal. Category 2 include dentinal adhesives with shear bond strength of 8 to 14 megapascal. Category 3 include adhesive with shear bond strength values above 20 megapascal. Bond strength of 17 megapascal. Figure 8, less than 17 megapascals, adhesive results in polymerization forces causing the resin to contract towards the center of the composite, which pulls the restorative materials away from the cavity walls. Figure 8 and 9, which shows when there is more than 17 megapascal of adhesion, the polymerization contraction causes shrinkage of the composite towards the wall of the cavity. Water tree, all-in-one adhesives, very acidic and hydrophilic. They are hydrophobic. They attract and absorb water, leading to etching unpolymerized monomers or hydrolytic degradation product to the water-filled channels called water tree. These channel passes from the hybrid layer through adhesives to adhesive composite interface. Lower bond strength, less durable, does not occur in self-etching primers, or adhesive systems. Reverse water tree. In case of reverse water tree, they may appear to originate from the water trapped at the interface between the adhesives and the overlining resin composite. During light curing, some of the water has been released at the top of the adhesive layer and can't escape. The heat generated by the light curing reflect the water back into the less polymerized surface. They spread downwards with their branches pointed towards the dentine. Reverse water tree are frequently affiliated with the water bristles that are entrapped along the adhesive composite interface. Theories of water tree, water remnant theory, left out water, water flux theory, evaporated or osmotic. Amalgam bonding, must have auto polymerization capability, first layer light cure, bond strength 2 to 20 megapascal, advantage, conservative conservation preparation, increased fracture resistance of restorator, seal margins better, decrease post-operator sensitivity, present prevent permeation of corrosion product. Example, all bond, amalgam bond plus clear fill liner bond. Ceramic bonding, conventional silica based, partly of mechanical interlocking and partly of chemical union. Mechanical retention is obtained by etching, fitting the surface of porcelain with dilute hydrofluoric acid or amino bifluoride to reduce to increase the surface roughness and allowing low viscosity resin to penetrate into the pore by capillary action. Chemical union occurs by interaction of silicate ceramic surface and silicone coupling agent of composite. Inert ceramic, aluminum oxide and zirconia based, air abrasion, tribochemical surface treatment, phosphate based adhesives, cementum bonding. One of the most frequently clinical problems associated with class 2 and class 5 cavity in adhesive resin restoration is weak link of the restorative material to the root dental structure when marginal cervical margin is located below the cemento-enamel junction. Ferrari et al. Reported that the cementum treated with dentine bonding system is infiltrated by resin, but the predictability of the resin bond is unclear. The shear bond strength of the resin composite to EDTA conditions sound cementum after treatment with an aqueous primer composed of 5% butylaldehyde and 35% hydroxy ethylmethacrylate was estimated as 6 megapascal. It seems that after demineralization, the increased intrinsic fibril content of intact cementum surface creates an organic network that lacks cohesive strength of demineralized dentine collagen, and although it is reinforced by resin infiltration, results in low bond strength. Recent advances: Futura Bond DC, it's a 8th generation. It is a dual cure and work with all light and self-cure dual cure resins. It work with self-cure mode without any light. Great for endo, takes only 35 seconds to start and finish, needs only one coat. Surplus, a universal 8th generation bonding agent, consists of 3 bottles, an etchant, conditioner, primer, and a separate hydrophilic bonding resin. Etchant and conditioner are not rinsed. Bond strength is 50 megapascal. Fluoride releasing bonding agent, anti-karyogenic, increased dentin bonding strength, increase the local concentration of fluoroapatite in the mineralized dentine just beneath the hybrid layer, prevent the release of the hydrolytic enzyme from the matrix, reduce solubility of the intrinsic calcium phosphate with the hybrid layer. Example, clear fill, 1 up bond, G bond. Fluoride releasing bond 2. FL bond is a self-etching fluoride releasing two-step adhesive system which features an excellent bond to in both enamel and dentine and provides a secure marginal seal. This primer has a new effective adhesive promoting monomer and a photoinitiator which is free of HEMA and acetone and is considerable minimize odor post-operative sensitivity. FL bond agent incorporates fluoride containing SPRG fillers, surface pre-reacted glass ionomers, which continuously provide fluoride to the tooth surface. Matrix metalloproteinase, host derived from the matrix metalloproteinase found both in saliva and H-dentine has been shown to evolve in the degradation of unprotected collagen fibrils within the hybrid layer. Role of the MMP inhibitors. Dentine MMP can be activated following the demineralization of the dentine surface by acid, resulting in collagenolithic and granulolitic activity. Effective synthetic MMP inhibitors must contain a functional group, that is carboxylic acid, hydroxamic acid, capable of chelating the active site zinc ion. Results in improved micromechanical retention. Example is chlorhexidine, 0.2 to 42%, quaternary ammonium methacrylate resin monomers. Desensitization. Precipitation of protein in tubules penetrates the tubule as far as 200 μm, forms a series of bridge across the tubules impermeable to the odontoblastic fluids. Example, gluma. Multi-purpose bonding. Scotch bond universal adhesive is combined total H, self-H and selective self-H adhesives. Etchants, 35% phosphoric acid, primer, water 40%, HEMA 47%, polychronic acid, copolymers, adhesive, BIS-GMA, HEMA, and initiators, accelerators. It offers only one simple adhesive application technique for both direct and indirect application and bonds to all surface including enamel, dentine, glass ceramics, zirconia, noble and non-precious alloys, composite without additional primers. G-bond, 4-met monomer, strong consistent to dentine, phosphoric acid, ester monomer, consist bond to enamel, nano interaction technology, non-conventional interface with dentine, a nano interaction zone with minimal decalcification, almost no exposure to the collagen fibers, ionic bond with hydroxyapatite to the tooth structure. Nanofilled adhesives. These adhesives were mainly silica or glass of varying sizes. Higher filled, larger particle adhesives yields stronger physical properties. These nanofillers are generally amorphous silica dioxide, which is 100 times smaller than the fillers in hybrid composites, which results in optimal property. Advantages: increased adhesive strength, increased marginal integrity, subsequent thickness from one put or one cure technique, deeper penetration. Adhesives, filled adhesives can be rubbed on the surface, left particles, small spaces between the collagen fibrils are not clogged. Antibacterial agent, Clearfill SE Protect, and antibacterial self-etching adhesives. SE Protects contain antibacterial monomers, MDBP, which disinfect the tooth surface during application. Go, one component of self-etching light cure adhesive. Go is a super quick quicker adhesives, HEMA-free, no post-operative sensitivity, high fluoride release, and quick color change. Frog self-etch adhesives, self-etcher, frog self-etching primer infiltrates cut tooth surface, effectively dissolving the smear layer formed during the cavity preparation. Optimal pH, frog optimal pH of 0.2 allows unblocking of dentinal tubules without aggressively decalcifying the tooth structure. The gripper, frog deeply penetrates to form a very strong bond, enabling a perfect grip to the tooth structure. Maintain the hydroxyapatite in the collagen fibril, assisting in micromechanical bonding to the adhesives to the tooth surface. Protecting the pulp, post-operative sensitivity is prevented, and no separate etching, washing, or drying is required. Hence, overdrying cannot occur if patient discomfort is maximized. Nano. A frog is specially treated nanofill to improve cohesive strength of bond and ensure good adaptation of the tooth structure when applied to both enamel and dentine. Low film thickness. Frog low film thickness is 12 microns, ensures the invisible margins. Pulp capping agent. Direct pulp capping with dentine bonding system, human teeth, a clinical and histological evaluation. This study evaluated the pulpal response in dental pulp and direct pulp capping with a single bond adhesive system. Conclusion: SBAS should be avoided for the vital pulp therapy while CH remains capping agent of choice for mechanical exposed human dental pulp. Adverse effects of human pulp after direct pulp capping with different components of from a total H and 3 cell step adhesives. Group 1 acid primer plus adhesives were used, recommended. Group 2 only primer were applied. Group 3 only bonding resin. Group 4 only composite resin. Group 5 calcium hydroxide. Conclusion: adhesive component as well as composite should be avoided for pulp capping. Calcium hydroxide should be the first choice for pulp capping. Thank you.